If your legs look like a road map, you may think that the visible veins on your legs are just a part of aging and nothing you can do about it. Besides, those veins really aren't hurting anything, are they? Here to answer those questions about vein therapy is Dr. Joddi Neff. She's a doctor of vascular medicine from Premier Aesthetic and Laser Center. Welcome, Dr. Neff. Nice to have you here.
Thank you for having me.
That is true that people see these veins on their legs and they think, you know, there's nothing I can do about it. It just happens with age.
Right.
And when that attitude is not true. And it's not always age, is it?
Right.
So explain the difference between, I mentioned varicose and spider veins. Are they different?
They are different. Spider veins are those blue or purple thin veins just underneath the skin. And they sometimes form in clusters, which kind of gives them that spider appearance. Now, varicose veins are those large ropey veins that kind of bulge out when people have been standing for long periods of time. And the difference is important. There's some that cause symptoms and some that don't.
And when you say symptoms, what would they cause?
Well, the larger veins typically cause symptoms of leg heaviness, swelling, achiness, worse towards the end of the day. Mm-hmm. And that indicates to us that there's an underlying vein problem. Okay, and years ago, those used to be treated with vein stripping, which sounds horrible.
It does, and my mother actually had that done.
Right. Well, now there are easier procedures, minimally invasive. We do something called endovenous laser ablation, and we've actually been doing that the longest here in Columbus. It's a medical procedure. It's very straightforward, and since it's a medical procedure, it's covered under insurance.
Now, one of my questions. Okay.
Yeah, and now spider veins, they are more of a cosmetic concern. They really don't cause symptoms. And we treat those with either sclerotherapy, or we can also do surface lasers, but we found that sclerotherapy seems to give a better result.
Let's take some video of the sclerotherapy as you describe it. It's a long word.
It is.
So explain what we're looking at when you're doing this, Dr.
Sclerotherapy, I'm using a vein light that just helps me see the vein a little bit easier. But basically, it's where we inject a chemical solution into the vein, and it flushes the vein out, and it basically disappears for a second. It might be hard to see on the video. Now, the vein will refill and reappear. But the goal is that solution irritates the lining of the vein, and over the next several days, the vein will collapse and disappear for good.
And can that be okay?
Yes. Yeah.
It doesn't cause any other. It's not harmful to the veins at all.
You don't need these veins. They're superficial veins. It's all cosmetic. And I will say, too, a common solution that's used is hypertonic saline, which is basically salt water. And as you can imagine, that burns when it's injected. But we use something called polydocanol. And what we found is they don't get the burning sensation, there's less side effects, and we get much better results with that solution.
So there's minimal pain from the solution. You're using a little needle, but it's a little needle,
right.
So I don't know how much pain is involved with that.
It's very minimal. You might feel a few needle pricks here and there, but I've had women who tell me, they've been so embarrassed by the way their legs look. They haven't worn shorts or skirts for years, and they're afraid of how painful it could be.
Wow, look at the difference
here, Dr.
Neff.
It's amazing. And then once they have the procedure done, they're amazed by how quick and easy the procedure is, and how little discomfort's involved. They wish they would have done it years ago.
Well, will it stay this way, or will these veins come back?
It will stay that way if those are successful treatments. I will say there are sometimes veins that can be stubborn and they need to be treated again. So I always tell people, you might need more than one treatment. It's not uncommon. And of course, it depends on how many veins you start with and what you want your end result to be like.
Is it hereditary?
There is a genetic component. There are many different things that can contribute to leg veins. It can be your profession, standing for long periods of time. Definitely a genetic component. Many patients say, my mother or father had veiny legs. And then women tend to get veins more often as well. And, of course, I think they seek treatment more often because they're more concerned about how their legs look.
Well, yeah, most guys aren't wearing skirts, so.
That's right.
I can understand how women would want this taken care of.
Definitely.
You mentioned that the varicose, because they can involve some serious vein issues, is covered by insurance. For spider veins, how does that go with insurance agencies for the most part?
Unfortunately, sclerotherapy is not really covered under insurance because it's not really medically necessary. It's more of a cosmetic issue.
Or peace of mind.
Yeah, exactly. So, if we do think there's an underlying problem, we certainly work that up and make sure that, if it is a medical problem, we treat that first and make sure that goes through the insurance.
Dr. Neff, quite an education today. Thank you. Nice to have you.
Thank you.